After 70, many seniors feel like their life is a never-ending list of medical tests. Blood work, scans, scopes, stress tests. Sometimes it feels like you spend more time in waiting rooms than enjoying your life. Some of these tests can be life-saving, but others offer very little benefit for certain older adults, and sometimes lead to extra worry, extra procedures, and side effects you never planned for. In this video, we're going to look at 5 common checkups that seniors should think carefully about after 70. Not tests you should automatically refuse, but tests where it's very important to ask, what will this test actually do for me? Before we start, tell me in the comments, where are you watching from? How old are you? And have you ever felt overwhelmed by how many tests your doctor ordered? I read as many comments as I can and use your questions to plan future videos. And remember, this video is for education only and is not medical advice. Never stop or skip a test just because of an online video. Always discuss your own situation with your doctor. Let's begin. Number 5. Bone density scans, also called DEXA scans. A bone density scan measures how strong your bones are and is used to look for osteoporosis. For many people, especially women after menopause or anyone with a history of fractures, it can be very useful. But after about age 70, how often you repeat these scans and what you do with the results matters just as much as the test itself. Bone loss is a normal part of aging. Mildly lower bone density, called osteopenia, is very common and doesn't always mean you need strong prescription drugs. Some older adults are started on bone medications for very small changes on a scan, even when they've never had a fracture and are otherwise doing well. These medicines can help some high-risk patients, but they also have possible side effects, especially when used for many years. For many seniors, lifestyle steps, like strength training, balance exercises, enough calcium and vitamin D, and fall prevention at home, may reduce fracture risk more than repeating scans frequently. Questions to ask your doctor. What is my actual risk of breaking a bone in the next 10 years? If my scan is only a little low, would it change what you recommend? Or would we still focus on exercise, diet, and preventing falls? How often do I really need this test at my age? Number 4. Brain MRI for mild forgetfulness. When memory slips a little, it's natural to worry about dementia. Many seniors are sent straight for a brain MRI as soon as they mention forgetfulness. MRIs are very important when there are serious or sudden symptoms like stroke signs, seizures, big changes in personality, or rapid decline. But for mild, gradual forgetfulness, especially if you're still managing daily life, a brain MRI often doesn't change treatment. Scans in older adults frequently show age-related changes, small spots or shrinkage that are common and not always linked to disease. For some people, seeing these findings creates more anxiety than answers and leads to more tests that still don't change what needs to be done. A better first step for many seniors with mild memory concerns is a simple cognitive screening test in the clinic, along with a review of sleep, mood and stress, medications, vision and hearing, vitamin levels like B12 and thyroid function. These are often more treatable than what an MRI shows. Questions to ask your doctor. Will this MRI change what we do, or are there simpler tests we should do first? Are my symptoms severe enough that imaging is really needed right now? Could medications, sleep problems, depression, or stress be playing a role? Number 3. Cardiac stress tests in people without clear heart symptoms. A stress test looks at how your heart behaves when it's working harder, often by walking on a treadmill. This test is very important when someone has typical heart symptoms, such as chest pain with activity, shortness of breath with light exercise, or a noticeable drop in what they can do physically. But in older adults who are only a bit more tired or who don't have clear heart symptoms, Stress tests can sometimes lead to false positives, results that look worrisome even when the heart is actually okay. Those unclear results can lead to more invasive tests, like angiograms, and sometimes procedures such as stents or bypass surgery that may not improve symptoms or lengthen life in low-risk patients. Questions to ask your doctor. Why are you recommending a stress test? What specific symptom are we looking into? If the test is abnormal, what would the next step be? Are there simpler options we can try first, like a resting EKG, blood tests, or watching my symptoms with gentle exercise and follow-up? Number 2, routine colonoscopy screening in older age. Colonoscopy can be a powerful tool for finding and removing precancerous polyps. That's why it's widely recommended earlier in life. But after a certain age, the balance between benefit and risk changes. Many national guidelines suggest that routine colon cancer screening often stops around age 75 for average risk adults, and decisions after that should be individualized based on overall health, past test results, and life expectancy. In older adults, colonoscopy carries higher risks. Dehydration and electrolyte problems from the bowel prep, complications from sedation bleeding, or rarely, perforation of the bowel. For someone who has had several normal colonoscopies and has no new symptoms, the added benefit of another screening exam may be small, while the risks grow with age. However, if you have new symptoms, such as rectal bleeding, unexplained weight loss, or a major change in bowel habits, a colonoscopy can absolutely still be necessary and important, even after 70. Questions to ask your doctor. Given my age and overall health, do major guidelines still recommend colonoscopy for me? What did my last colonoscopy show, and how long ago was it? Are there non-invasive stool tests, like the FIT test, that might be reasonable for me instead of another scope? Number 1, whole-body CT scans. Just to check. Full-body CT scans are sometimes advertised as executive checkups or sold as a way to find cancer early. But major radiology and cancer organizations generally do not recommend full-body CT scans for people who don't have symptoms. These scans expose you to a relatively high dose of radiation, and they often pick up harmless small findings, tiny nodules, cysts, or calcifications that may never cause problems. Once those spots are seen, it can be very hard to ignore them. That can lead to more scans, invasive biopsies, and a lot of anxiety, without clear evidence that starting with a full-body scan helps people live longer. This is very different from targeted imaging, for example, a CT of the chest because of a persistent cough, or a CT of the abdomen because of severe unexplained pain. Targeted scans for specific symptoms can be extremely important and appropriate. The concern is with broad, just to see, full-body packages in people who feel well. Questions to ask your doctor. Is there a specific reason to image this part of my body, or is this just a general scan? What are the risks from radiation for me? If the scan finds something small and uncertain, what would we do next? Let's pull this together with 4 simple questions you can ask before agreeing to almost any test after 70. Why now? What symptom, risk factor, or guideline is this test based on? What happens if we don't do it yet? Can we safely watch and wait, or try lifestyle changes first? How will the result change my care? If the test is normal, what will we do? If it's abnormal, what will we do? What are the risks and downsides? Think about radiation, sedation, anxiety, cost, and the chance of more procedures. If your doctor can explain these clearly and the benefits outweigh the risks for you, testing makes sense. If the answers are vague, it's okay to slow down and ask more questions or even seek a second opinion. To recap, after 70, there are 5 tests that are especially important to discuss carefully with your doctor: bone density scans, DEXA, brain MRI for mild memory loss, cardiac stress tests without clear heart symptoms, routine colonoscopy screening in older age, whole-body CT scans, just to check. The key message is not never do these tests, but make sure they're right for you. Real prevention still comes down to the basics. Stay active, eat well, don't smoke, limit alcohol, sleep enough, manage stress, and stay socially connected. Have you or someone you love ever gone through a test or procedure that felt unnecessary in hindsight? What happened, and what did you learn? Share your experience in the comments. Your story might help another senior ask better questions and feel more in control. If you found this video helpful, please like it, subscribe to Mental Wellness Theory, and turn on notifications so you don't miss our next senior health guide. And remember, this video is for educational purposes only and does not provide medical advice. Always discuss tests and treatments with your own healthcare provider who knows your full medical history. Thanks for watching, and I'll see you in the next video.